think HEAL will really bring so many innovations when it comes to new ways to link to care, new treatments, both opioid and non-opioid. And when we're looking at addiction, all the different modalities right now to continue to look for new ways that we can address this. At CDC, the Injury Center leads the majority of the drug overdose prevention efforts. CDC worked with NIH and other agencies to update some of the naloxone guidance that came from the department.
There's been a great deal of federal collaboration around this epidemic. The FDA has a really broad remit with regard to the opioid crisis, and there's a tremendous amount of interest in making antidotes for overdose available widely. And so the states have had collaborative practice agreements so that pharmacists can simply dispense naloxone to people. The FDA has been working on over-the-counter switch. But while this epidemic is raging, we have to make sure antidotes are available at the place where those overdoses are going to occur.
We know that anoxic brain injury, which is what kills people who are having an opioid overdose, occurs in about 4 to 5 minutes. We know that there is not an ambulance out there that can consistently get from point A to point B in 4 to 5 minutes. Only about 40% of overdoses are receiving any sort of treatment. And so I've asked people all across America to be willing to carry naloxone because all of us can play a role in saving a life if we're willing to carry naloxone.
It's all hands on deck as far as this problem. And the HEAL effort is really going to help because it's infusing the researchers, supporting them, bringing them into this collaboration in a meaningful way, generating new data and new ideas. And I think this will continue and it will be very good for patients.